Well, hospitals across the country are filled with COVID-19 patients, but doctors are finding an absence of patients with cardiovascular conditions like heart attack and strokes. And there is some evidence that people may be avoiding care and ignoring symptoms out of fear of contracting coronavirus. Let's go deeper on this with Dr. Warren Levy, cardiologist and chief medical officer of Virginia Heart. Dr. Levy, thanks for coming back on with us. We appreciate it.
Good morning, Debbie. I hope you're all doing well and are safe.
Same with you. So you've been looking at some data, I'm told, showing a decline in patients with cardiovascular conditions visiting the ER. What are some of the reasons heart attack and stroke teams are less busy right now?
Well, it's one of those things that really sneak up on you. We've all been so hyper-focused on COVID, and suddenly we turned around and said, we're not seeing as many heart attacks all of a sudden. And we talked to our colleagues around the country and around the world, and we're seeing that everywhere, whether it's Italy or Spain or England or up and down the East Coast. The number of patients presenting to hospitals with heart attacks has clearly gone down. Mm-hmm. And there's no reason for heart attack rates to decrease now. In fact, we're in a very stressful environment, and we know that heart attacks go up during stressful times. Following any natural disaster, even in the losing city of the Super Bowl, heart attacks go up. And I think the only thing we can conclude is that people are afraid to come to the emergency department because they think they're going to get infected, even though they're having serious cardiovascular problems and riding them out at home. And that's a huge problem. And we need to reassure everyone that if they're having symptoms that they think are cardiovascular at all, they need to come into the emergency room. We are prepared to evaluate them. We're not just dealing with COVID right now. We're dealing with all of the health issues people have.
So obviously you're concerned that conditions could get worse than they are. Is it concerning in terms of treatment options? If you wait too long to get to the ER, are they more limited at that point?
Well, absolutely. Not only is there the risk of having something terrible happen if you don't come in right away, but then there are all the later consequences of not treating these problems right up front. In fact, we just saw a patient who wrote out a heart attack and then came in 3 days later because they had a rupture of part of their heart, which is a known complication for an untreated heart attack. And we're going to see more problems down the road with heart rhythm problems, with heart failure. These patients need to come in and be treated the way we treat patients today. We've made tremendous progress in the last several decades in saving lives and preventing downstream problems, but we have to treat them right away. Time is critically important.
Dr. Levy, lots of folks, even beyond cardiovascular issues, are afraid to go to the ER at this point because they're afraid they're going to bump up against all kinds of people infected with COVID-19. So what's the best way to lower your risk of infection if you feel like you have to go to the emergency room for something?
You're absolutely right, Debbie. It's been documented that there are fewer gallbladders and appendixes coming out as well over the last couple of weeks. Mm-hmm. If you're going to go to the ER, wear a mask. Go in, be very clear with the triage nurse of why you're there and what your problem is so that they can get you the correct attention as quickly as possible. One of the things I think that can be confusing for folks out there is what is the difference in symptoms associated with COVID and cardiovascular symptoms. And just remember that with an infection, you're going to feel sick for a while before you start having any respiratory or chest symptoms. If those symptoms start acutely right away, that's not going to be an infection. You need to get medical attention right away.
All right. Great information. Very important. Thanks, Dr. Levy. We really appreciate it. Stay healthy.
You stay healthy too, Debbie. Bye-bye.
Thanks a lot, Dr. Warren Levy, cardiologist and chief medical officer of Virginia Heart.